Well, good morning. Again, it's such a pleasure and privilege for me to be here and to be able to work with you and meet you and share thoughts on a number of topics. Today we'll be talking about trauma advocacy. I'm in my sixth year of having the privilege of chairing the advocacy pillar and advocacy committee for the Committee on Trauma. It has been a fascinating learning experience for me. I came to the position with little to no advocacy experience. I would have to admit to you that I wasn't quite sure what the term meant, but I was eager to learn. So it's really been fascinating, and it's really a pleasure for me to be able to speak with you on this topic. So I'm going to tell you a little advocacy story to kind of set the framework for this conversation. It's a funny-looking slide, I know. It took me a long time to put it together because I'm not, a real whiz at PowerPoint, but let me tell you what it all means. So a friend of mine who's a urologist, he's actually a trauma reconstructive guy, good guy, when I told him that I had been asked by Ronnie Stewart to serve as the chair of the advocacy pillar, he said, well, I hope you enjoy it. I did a little bit of that, and I really didn't care for that kind of work. I don't think I'm, just the right guy for it. So I said, well, why? What was your experience? So he said, well, I went to Washington with the American Urological Association Advocacy Day, and I had a list of legislators I was supposed to meet with, and I was sitting in the congressman's office, and I found myself sitting on a tiny love seat that was maybe barely big enough for two small people, and I was crammed in there with three big guys. The guy on my left was the soybean lobbyist, and the guy on my right was the Hyundai lobbyist, and each of them had a fancy iPad, PowerPoint, nice presentation, and I had a little stack of index cards with a few comments scrawled on it that I was supposed to discuss with the legislator, and I was the last guy to come in. At least I had a little more room on the love seat. And, I gave my spiel, and, it just didn't feel terribly compelling to me. He said, I felt like a drug rep. That was his comment. So my response was, well, first of all, what's wrong with that? I mean, we've got some great friends and colleagues who are drug reps and salespeople from industry, and they do very respectable work. And number two, maybe the problem is that that's exactly what you were, because you have to advocate for things that are meaningful to you, that you're passionate about. And a lot of what he was talking about, I think, was areas where the advocacy issues were really focused on sort of preserving earning potential for the urologists. He was talking about trying to keep it legal for urologists to be owners of radiotherapy centers that they were referring their patients to, and he was talking about how important it was that we'd be able to purchase Lupron, which is this cancer drug that we use for metastatic prostate cancer, purchase it from the manufacturer for a very low amount of money, and then give it to the patient for a hugely increased amount of money. And this is during a period of time when a lot of urology practices were making a significant portion of their revenue selling their Lupron in this way. So I said, well, maybe it was the issues. Maybe aside from being squeezed into the love seat and talking to the staffer and not the congressman, you weren't passionate about the issues. And I think that was the case. So I got interested in advocacy early. I was a fellow serving as an instructor, junior faculty member at Ben Taub Hospital soon after residency. And I was pretty much the trauma staff at Ben Taub because we didn't have much in the way of faculty coverage in those days 30 years ago. And I was consulted intraoperatively for gross hematuria noted during a laparotomy for a gunshot wound to the pelvis. The patient was a 13-year-old girl, and she was a bystander injured in a firearm attack in a gang-related event. It turned out she had a bladder injury, big injury to the anterior and posterior bladder wall. I believe, if I recall, it was a high-velocity injury, and a transected ureter. And she had complete destruction of the fundus, the body of the uterus, which was actively bleeding. So I repaired the bladder, I reimplanted the left ureter, and essentially debrided the uterus, essentially almost down to the cervix, sutured the small uterine segment, all the time thinking, there's a 13-year-old girl who's an innocent bystander who no longer has a uterus. and being just extremely distressed by the situation. And this was the second pelvic gunshot wound that I took care of in a female in a week. And at the time I felt like, in addition to just working on this patient and trying to help the individual, I really feel like I would like to be able to do something, contribute something to this social and public health problem. But I didn't. I didn't really do anything other than just progress in my career. I knew it was important, but I didn't know what to do. I didn't know how to proceed, and I just sort of pursued my day job and progressed in the academic life of an academic faculty member, but never really let go of the notion that as a trauma specialist, that I should be doing something more than providing patient care. So this is from the internet from yesterday, and obviously the problems continue and they grow and they continue to eat at us, but we have opportunities to do things about it, and we are doing things about this problem at a level that really has never been seen before in this country. So I think part of the secret to effective advocacy is being passionate about what you're advocating for. And each of us is here for a varying set of reasons, but I think we're all passionate about trauma care and trauma care availability and the quality of trauma care that we provide. So what exactly are you passionate about? What do you really want to contribute to in a very material way in addition to your clinical work? Access to high-quality trauma care, injury prevention. The Committee on Trauma has an extremely active and very robust program in injury prevention chaired by Deb Cools from Nevada, who's doing a superb job in that capacity, focusing on firearm violence reduction. But there are so many issues about injury prevention that are relevant and that are active right now. Everything from distracted driving to geriatric fall prevention to helmet laws and speed limit laws and just about everything you could think of. This committee within the Committee on Trauma and Injury Prevention is working hard on. Maybe you're passionate about the initiatives towards a robust military-civilian partnership and how we can support in the civilian environment a state of surgical readiness amongst our military colleagues. Maybe you're passionate about international outreach and you've got the heart of a medical missionary and you want to do something to optimize trauma care and trauma systems around the world. Maybe you're interested in some legal issues such as protection from liability for providers who go to disaster situations and contribute their time and effort without compensation. Maybe you're focused on community education. Arizona is doing a phenomenal job with the Stop the Bleed program and in many other areas of community education. So deciding really where you want to put your focus, I think, is important. And then understanding really what is advocacy and what are the opportunities to participate in advocacy initiatives is important. So taking the lead from colleagues from yesterday, I went to the internet and pulled up definitions, and here's a definition of advocacy: public support for or recommendation of a particular cause or policy. I think that's a good working definition. From Wikipedia, advocacy is an activity by an individual or a group that aims to influence decisions within political, economic, and social systems and institutions. Both, I think, highly applicable definitions for the work that we do. So how does advocacy work within the American College of Surgeons? This is just a basic structural overview diagram to help you understand what are the components of the advocacy effort within the college that we should all know about. The overarching group that oversees the advocacy and health policy work from the college is the Health Policy and Advocacy Group, or HPAG. And reporting up to HPAG are a number of other key committees and structures which actually do the daily work of health policy and advocacy within the college. There's a legislative committee, which is very active. There's a surgery coding and reimbursement committee. There's the Health Policy Advisory Council, and there are state contribution opportunities at that level. And then there's the Surgeons PAC, the American College of Surgeons Political Action Committee, which has a board of directors. And all of these play complementary roles in furthering the advocacy agenda of the college, which is very broad and very diverse, but for which trauma actually occupies a very central and critical place. So the importance of advocacy, I think, is probably fairly clear to all of us. Healthcare is a constantly changing landscape, and it will continue to change and evolve either with or without input from surgeons, from trauma specialists, from the trauma teams. And in today's environment, it's really important to be involved in order to be part of the solution and be active rather than allowing healthcare reform and healthcare changes to occur in the absence of our input, because our input is critical to the needs of our patients. It's important to remember that advocacy helps raise awareness and elevate the profile of legislative and health policy issues that impact our profession in the broadest sense. Advocacy enables us to serve as a trusted resource to colleagues, to the Washington, D.C. offices of legislators, to members of Congress, and to their staff. And one thing that I learned in going to the Leadership and Advocacy Conference through the college on several occasions over the last few years is that when you get your list of legislators' offices that you're going to be going to visit, the congressmen and senators, you won't necessarily meet with the congressman or the senator. And I remember initially feeling like, well, you know, don't we warrant the FaceTime directly with the congressman or the senator as opposed to the staffer? But I came to understand the value and the importance of the impact of meeting with key staffers. Because if you're a member of the United States Senate, you've got a large number of issues that you're having to address on a constant basis. You cannot be an expert in all of them. You may not even be an expert in more than one or two. And let's just say that healthcare is not one of those areas where you personally possess an enormous level of expertise. You will be highly dependent, if not almost completely dependent, in terms of how to vote on key legislative initiatives, highly dependent on the knowledge and expertise of your lead healthcare staffer. So if you meet with the lead healthcare staffer of a member of Congress and you can convince them that this initiative is worth having your member of Congress vote for, then you probably have done more good than just cornering the senator in the hallway and mentioning it to him in an offhanded way. So meeting with that staffer is actually extremely valuable. And we've learned that through a variety of legislative efforts through the college. So you certainly should view it as a very positive thing to meet with a lead staffer for the healthcare voting recommendations. The advocacy initiative needs to be an immediate priority. And there's so much happening right now at the federal level and also at the state level with regard to trauma advocacy that it's an extremely important and impactful time to be involved. It's important to be involved early, recognizing that it can actually take time before a relationship is built and palpable impact is seen. So any one of us in this room, and every one of us in this room, can and should play a role in trauma advocacy. Whether you're a trauma surgeon or a member of the trauma team at any level of professional involvement, you have expertise, you have experience, and you are a constituent. So everyone should feel thoroughly empowered to be involved in advocacy. And when you look at the whole issue of congressional accountability, I mean, what are the things that motivate a member of Congress? There are two groups, really. The constituents and the supporters. That's the reality. So the constituents are those people who vote for and can communicate with them, people in the Congressional district or in the state for the Senate, and the supporters, the individuals who invest in their campaigns. And there are two ways of participating in that through the college. One is becoming knowledgeable about the items that are listed under Surgeon's Voice through this website within the college website. And then the other is participation for those who are eligible to contribute to the Surgeons PAC, the Political Action Committee. And that would be fellows of the college and those who are employed directly by the college who are U.S. You have to be a U.S. citizen or resident of the U.S. to participate in the Surgeons PAC. But these two entities are important. They play a huge role in our ability to serve actively in the advocacy realm. So I'll give you a few highlights of what's happening both at the federal and the state level, and then talk a little bit more about how any of us can be involved. At the federal trauma legislation level, there are some very important initiatives that have been pursued and really some remarkable initial successes that have been seen in the last year or so. The college supported H.R. 8, which is a bipartisan background check act of 2019. It passed the House in February with a significant vote. And basically this would require all firearm sales to go through the National Instant Background Check System as established under the Brady Handgun and Violence Prevention Act. You probably all know that there are lots of ways of buying a gun in this country that don't require a background check, whether it's gun shows or personal person-to-person sales. So this is an effort to get that whole process under reasonable control with a significant focus on enhanced safety. It passed the House, and a number of these issues probably aren't going to make it through the Senate, realistically, in the current Congress. But the fact that these measures now are actually getting voted up in the House put us way forward than where we were even a couple years ago in having a real legislative impact as Congress changes over time. In June, the House passed a historic firearm research funding initiative, 2020 Labor, Health, and Human Services spending bill, which would provide $50 million for firearm morbidity and mortality prevention research. It wasn't long ago that the notion of getting federal funds for firearm research would have been just outlandish, that there were so many obstacles to being able to actually get that to happen. But the fact that this now has also passed the House is tremendously encouraging. And this is where coalitions can have a huge impact on advocacy. The college joined over 100 other medical, public health, and research organizations asking Congress to appropriate this funding. When you get that large a groundswell of support across multiple professional domains, it is very difficult for Congress to turn away from it. And that is what happened in this case. It was an enormously supported bill from a huge number of important organizations. The college has provided important testimony on research and American college students' activities around the whole issue of firearm injury prevention. I think you all know that Ronnie Stewart, who was the past chair of the COT and now the trauma medical director for the college, has testified now several times before Congress, before the House Appropriations and the Energy and Commerce Health Subcommittee, and has had a significant impact on raising the awareness amongst our legislators on the importance of these critical injury prevention activities. This was a huge win. The Pandemic and All Hazards Preparedness Act, called PAPA reauthorization. On June 24th, this was signed into law by the President. And this was a tremendous win because of what it includes in terms of trauma support and trauma funding. The bill includes funds for the Mission Zero Act that creates a grant program to assist civilian trauma centers in partnering with military trauma professionals. This was part of the Zero Preventable Deaths initiative and the notion of having a military-civilian partnership be really active with federal funding to support these trauma centers that bring our military colleagues in to maintain readiness is an extremely important area of funding. Mission Zero was authorized at about $11 million for each fiscal year for the next 5 years. It's not a massive amount of money in terms of what the Congress can appropriate for major healthcare-related initiatives, but it's a start and it's a significant move forward. And all of us from the advocacy pillar would just like to thank all of you who reached out to membership concerning this priority over the last year. I think the groundswell of support and the grassroots efforts and the contact with legislators really had a very big impact, a direct impact on getting this over the finish line. So this was a huge win. There are a variety of types of grassroots activities that people can get involved in terms of advocacy. We can all participate in both federal and state initiatives, ongoing advocacy efforts. There are legislative calls to action that come up on Surgeon's Voice, if you kind of monitor that on a regular basis, targeted campaigns regarding specific pieces of legislation, and then this concept of grassroots versus grass top outreach. It's an interesting concept. Grassroots advocacy basically involves reaching out to constituents in legislative districts or congressional districts and encouraging them to contact their legislator regarding issues that they care about. Grassroots advocacy is a sort of informal term used when we try to focus on key opinion leaders and people who are directly connected to legislative officials, and both of these are complementary, and they're both very important ways of having an impact on moving legislation forward. There are several grassroots action alerts that are currently out there that are listed on Surgeon's Voice. That several are trauma-related. One is the Prevent Bleeding Loss with Emergency Devices Act, which is being pursued, and this hopefully would result in ultimately legislation that might require placing bleeding control kits in every government building or every public building, and some of these efforts have occurred at the state levels as well, so very important. And then the Bipartisan Background Checks Act that I mentioned earlier. Both of these are areas where if you get onto Surgeon's Voice, you can see ways that you can contact legislators and encourage them to support the bill. There are quite a few other initiatives that the college has in its advocacy agenda, aside from the trauma-related ones, and I've just listed several of these here, just so you can sort of get a sense of the enormous breadth of the advocacy initiatives by the college, including the surprise medical billing problems, which is not a trivial issue in trauma, removing barriers to colorectal screening, a variety of cancer research initiatives, palliative care initiatives, resident physician shortage, initiatives that are trying to solve the problem of the medical school classes growing enormously, but the number of residency positions not, which doesn't make a lot of sense. So these are important areas that the college is focused on in addition to the trauma-related issues. In terms of grassroots engagement opportunities, things that any of us potentially could do, one would be to attend the annual College Leadership and Advocacy Summit that I mentioned earlier, which involves important leadership training and also making visits to legislators on Capitol Hill and really trying to build a connection, build a relationship, and describe the advocacy agenda. Utilizing Surgeon's Voice online tools and resources that you can see on the American College of Surgeons website. Participating in various types of social media activities, becoming a member of the Political Action Council in your region, and then potentially joining the Advocate at Home program, which is also described in the Surgeon's Voice area. So what's happening in this state? Arizona's been very active and really has done some great work in state-related advocacy. There are a couple of bills that were pursued in 2019, SB 1165, which is prohibition on texting while driving, including the use of the internet, watching video, unless you're using it for navigational purposes. It passed out of the Senate, but it didn't pass through the House on the third reading. But the fact that a bill doesn't make it to law at the state level doesn't mean it wasn't worth pursuing. It means that you're working your way towards an ultimate success. And that's the way we have to look at these things, and it often is the case that there are several introductions or modifications of a bill that may be necessary before it generates enough bipartisan support to be law. And then another bill related to enforcement for seatbelt. So, Arizona has a good track record of activity at the state level in terms of injury prevention and other initiatives related to trauma. The Arizona chapter of the college, 2020 lobby day, I understand, is tentatively scheduled for January, and some of the focus issues will include trauma system funding, Stop the Bleed, and a number of other important initiatives, and you can find these on the website that's already been described. The advocacy pillar of the college has a strategic priority list. The whole Committee on Trauma went through a major strategic planning process when Eileen Bolger took over as chair about a year ago. And these are some of our key pillar strategy issues for the advocacy pillar within the college, including supporting the creation of a legislative and administrative framework for a national trauma system, supporting research funding, as I've mentioned. We're looking at the whole structure and membership of the advocacy pillar to make sure that we optimize engagement with the Committee on Trauma, supporting Stop the Bleed efforts, advocating for the various injury prevention initiatives that the Injury Prevention Committee is dealing with, supporting the Military Civilian Trauma Initiative, and then developing a variety of partnerships with federal agencies that may help us move some of these initiatives through a policy approach in addition to a federal legislative approach. So after 30 years following these experiences that I had as a trauma urologist, I finally had a real opportunity to participate in a meaningful level, and it's been fascinating and valuable for me, and hopefully has been a contribution that will have a lasting impact. I think you probably are all familiar with the efforts of this group. This is an article that was published in the Journal of the American College of Surgeons recently, recommendations from the American College of Surgeons Committee on Trauma's Firearm Strategy Team, the FAST work group, consensus under the leadership of Dr. Stewart again. And essentially what this group is a group of trauma-interested fellows of the college who are firearm owners, maybe firearm aficionados to a variable degree, but a group of people who came together to work on a process where, as firearm owners within the college, fellows of the college, where could we agree that there are key priorities that we can go out and advocate for. And the general belief was that if you have trauma surgeon firearm owners who can all agree on a number of critical steps that should be pursued, then it's very hard for an external organization that may be critical of such efforts to say, well, you all are just anti-gun people, you don't understand us, because we do. So this is a really important publication, and it has been at the root of a number of other key initiatives that have come since then. And this is a sort of artistic description of the consensus approach that was pursued by the FAST Working Group, this is all available in that publication in JACS, Journal of American College of Surgeons, and it goes through a series of consensus approaches and also a series of recommendations that the entire group could agree upon. And it has formed the basis of further conversations with groups as diverse as the National Rifle Association and multiple legislators' offices from both sides of the aisle. So these are important initiatives, and it's really been fascinating to be part of that conversation. Well, let me talk a little bit about the Surgeons PAC, because one of the ways that we can have the biggest impact on trauma legislation at the federal level, at the federal legislative level, is to participate in the PAC. So I'll just describe a personal experience that I had. It was early in my tenure as Advocacy Pillar Chair, and I got a call from the folks in Washington saying, your congressman is having a little fundraiser, a reception downtown in Houston, and we would like you to go and deliver a check, because this is a person who has been very supportive of many of the college's advocacy initiatives, and he's been particularly interested in trauma-related initiatives. So, he's somebody who we support. So we're going to mail you a check, and you're going to go there and meet the congressman and deliver a check to his team, and then just tell him who you are and how much we appreciate his support of college advocacy efforts. So I'd never done anything like this. I really wasn't quite sure. And other than knowing that I should probably put on a suit and tie, I really didn't know exactly what to do or what to say. But they coached me very nicely, and so I showed up. It was in a hotel downtown, and walked in, and there was probably 30 or 40 people in the room, and everybody was trying to get a piece of the congressman. I mean, it was like a mob. Everyone's trying to get a moment with the congressman. So I delivered my check and kind of waited my turn, and then finally got a moment to talk to Gene Green. And Gene Green was a really important member of Congress at the time. He was the ranking member on the Health Subcommittee of the Committee on Energy and Commerce. So he had in a position to have a very strong impact on health care policy. So, I chatted with him for a minute. I told him who I was. I told him I represented the American College of Surgeons, that we were very appreciative of his interest in the area. And he said, well, no, the things that the college does are really important, and it's really been a privilege for me to be supportive. And then he had a bunch of questions. He wanted to know some things about the medical center and what was happening at the institutions in the medical center. And, suddenly, all the other lobbyists were kind of standing around, like, having a drink and eating hors d'oeuvres, and I had a 20-minute conversation with the congressman, because he was very interested in what we do and what we are and what we can provide him in terms of knowledge and understanding about the entire landscape of healthcare. And that is how a relationship becomes established. And it was a really fascinating conversation. And since then, I had the opportunity to interact with the congressman on a number of levels. And if his staffer would call and ask, well, how does the college feel about this? I didn't always know, but I could get right back to them after talking to the folks in the legislative unit within the college, and felt like I was able to contribute something, even as a total novice, to this type of work. And this concept of enabling us to work with members of Congress and be a resource to them when they need information about healthcare, I found to be really sort of uplifting in terms of how the process actually can work. So here we are, that's again with Gene Green. This is in the Congressional office building. We're doing a Stop the Bleed training program, and a number of members of Congress came and went through the training, and their staffers came, and this entire Stop the Bleed initiative has been a tremendous positive initiative, both for patients and the community, but also for serving as an entree to legislators at the state and federal level, because they're very interested in this. They want to understand what it means, and they're very supportive, and their staffers all want to get trained. So it's been a great connection point. This is Dr. Wyrider, who preceded me as Advocacy Pillar Chair, and Dr. Bolger, who's now the current chair, and you can see, and Dr. Gestring, who was really one of the people that was behind the whole initiation of the Stop the Bleed program, and Jim Dodd next to him, doing a training session in the Capitol, Ronnie Stewart and various members of Congress, and another evening that we spent out with members of the U.S. Senate. So it's been an interesting opportunity to connect on Capitol Hill in areas where members of Congress really are interested, and they're very motivated to learn about what we're doing. So, every major medical organization has a PAC, has a political action committee. And I just want to point out where we stand. If you look at the specialty organizations that are above us, that means all of those organizations have a larger PAC than we do. So we're down below the osteopaths and below the ophthalmologists and below the dermatologists, and the emergency medicine folks, they give a lot of money to the PAC. The Dental Association is a remarkably generous contributor to its political action committee. And if you actually look at the numbers, about 3% of the fellows of the college actually contribute to the PAC. It's a pretty small number. And if you calculate it out, if 20% of the fellows of the college gave $200 a person, we would have by far the largest PAC of any medical organization in the country, if only 20% participated. So, how do you motivate people? I mean, what are the challenges in having a really large active PAC? We do have a large active PAC, but we have a potential for it to be much larger. And the size of the PAC, the amount of funds that the PAC has to be able to distribute to candidates that support the legislative agenda of the college is very much proportionate to how much money comes in on the PAC. So it's really an important issue. Just so you understand essentially how the PAC works, the PAC is nonpartisan. It supports House and Senate Democrat, Republican candidates for Congress. It does not participate at all in the presidential elections. It cannot earmark contributions for a particular candidate or cannot base it on a single issue. For the 2018 cycle fundraising, there actually was a slight decrease from 2016. And many of us feel that this is reflective of Washington fatigue, that there is sort of a sense of frustration or maybe passivity because of all the challenges that exist today in Washington and the way things are functioning. But that doesn't really, it shouldn't allow us to be less contributory. I think personally it should allow us to be more contributory to the process of having an impact on our members of Congress and on how legislation proceeds. In 2018, the disbursements were very much in line with party ratios, 57% Republican, 43% Democrat, and also included support for several newly engaged members of Congress and several key committee leaders. So giving to the PAC is a non-tax deductible contribution as a political contribution, but it really has a tremendous impact, and the PAC was a very important component of how we were successful with the legislation that I mentioned earlier. For Arizona, contributions are coming in nicely, but again, the participation percentage amongst those members who are eligible to give to the PAC is about what it is nationally, somewhere in the 2 to 3% range, probably by the time the calendar year finishes. And so we've got a lot of opportunity, even in this state as in all states, to increase the level of contribution. It's a very important part of what we are empowered to do in terms of federal legislation. This is just federal. So those of you who are eligible or can talk to your colleagues who may be eligible, certainly giving to the PAC is a simple thing to do. It can be done online or by text message, but it really has a big impact on what we can accomplish in terms of federal legislation going forward. We have a superb team in Washington. The Washington office of the college, I think, includes some of the most talented, brightest, most energetic lobbyists and legislative experts of any medical discipline. It's really a superb group of people. Katie Oman is the manager for the Grassroots program and for the Surgeons PAC. She's a very creative, very energetic person who's really been working hard to support efforts to grow the PAC. Austin O'Boyle is also involved in the Grassroots program. Hannah Shargan is our Congressional lobbyist for federal affairs, and she's doing a terrific job. She was really behind a lot of the legislative success, and Chris Johnson is the person who oversees state affairs. So the college does some very interesting things from the Washington office. In addition to the federal initiatives that I've mentioned to you and the legislative contacts that they develop to try to push these initiatives forward, they have a system where they monitor everything that comes up from a legislative or policy standpoint across all 50 states, and it's constantly monitored. So often what we'll hear of is this particular state has a bill that's coming before the state legislature, and we need surgeon input or trauma leadership team input quickly because it's coming up for discussion. So, we'll hear about this and we'll reach out to people at the state level, the state COT or other trauma leaders and provide them with a briefing, a toolkit, and then can get people in directly to the legislative hall where important testimony can be provided. We've had significant success in both supporting legislation that's very positive from a trauma advocacy perspective and also to sort of quash legislation that would really be very damaging from an injury prevention standpoint across all 50 states. So it's a superb service that the college provides, and they do it very expertly. So that's what I wanted to share with you in terms of advocacy. I think every one of us can participate. There are a host of ways, as I've mentioned, to be involved. We have a lot to offer, and I appreciate your interest in trauma advocacy on all the levels that you pursue, and there's a lot more that we can accomplish together. I thank you for your attention.